Hartford councilwoman Wildaliz Bermudez. And she is a Working Families Party member of the Hartford City Council since November of 2015. She has historically fought around issues ranging from police accountability to housing, immigrant resources, and refugee protections. In the last year, she's been on the front lines of key fights such as strengthening Hartford's Civilian Police Review Board, expanding funds to protect immigrant families facing deportation, and securing housing resources for early childhood centers in Hartford amid the economic crisis and the COVID-19 pandemic fallout from that. She's also spent time educating the community on resources available to them during the pandemic to promote civic engagement for the census and around national elections, and for advocating at the state and national levels for fair workplace scheduling practices, rent cancellation, and getting rid of ICE. So she's going to speak briefly about why Medicare for All is so crucial to low-income and communities of color, and to speak some more about her work in Hartford and in the state. So with that, go right ahead, Councilwoman Bermudez.
Thank you so much for having me. I really appreciate the opportunity, and I really appreciate all the work that all of you do on a daily basis. So I wanted to give you some perspective for those of you who are not necessarily familiar with Hartford. So as the capital city, just giving you a little background here, we have around 122,000 residents that live here. We are home to some of the poorest zip codes in Connecticut. And also we are known as a POC community. So we have a lot of people of color, communities of color in Hartford. And so the majority of the residents that we have in terms of demographic competition are of color. We have a very big West Indian population. In fact, we have the biggest West Indian population in all of the East Coast. And so one of the things that, folks ask us, well, where are they from? Where do people come from? And so our West Indian population, a lot of folks are from Jamaica, Trinidad, St. Lucia, and a lot of the respective Caribbean islands. We also have a very big Puerto Rican population as well, which is also part of the West Indies. And so we are a population, when we're looking at residents and their mobility, it's a population that over 30% of our residents don't have access to their own vehicles. So we rely very heavily on public transportation and other forms of transit, including, of course, bicycling, among other forms of transportation. And so it's a phenomenon, right, that we always indicate that is time poverty, because if you rely on public transportation sector and it takes you having to take 4 buses to get to your job on a daily basis, which adds to your regular quote unquote commute an additional 1.5 hours or 2 hours, then that's certainly what is referred to as time poverty. Then on top of that, in Hartford, we have 50% of our property that is untaxable. And so the reason for that being is that we have a lot of state properties, state buildings, and as well as our medical industry. So when I look at my next door neighbor, it's actually St. Francis Hospital. So we have a lot of hospitals that don't pay taxes, and we have a lot of nonprofits that don't pay taxes. And so 50% of our land that could be taxable is not taxable. And so with that, on top of all of that, on a daily basis, and this was before the pandemic, in the before times, we had roughly every single day between Monday through Friday, roughly 80,000 people driving into our city, so commuting from elsewhere and coming into Hartford to work. And as you know, since we are known as, the insurance area, the insurance capital, a lot of those jobs are insurance companies, health insurance companies. And so 80,000 before. It'd be really interesting to see now in terms of how many of those commuters are now, working remotely. But those figures we will get probably in the next 6 months or so. The neighborhood where I live in, Asylum Hill neighborhood, the footprint, as I mentioned, I started to mention, is pretty much comprised of hospitals on one hand, so St. Francis purchasing a lot of property, a lot of footprint where I live in my neighborhood, not just for buildings, but also for parking lots. So what ends up happening, right, in the evenings is all these parking lots are empty. And in the weekends, all the parking, and so that you see how that really changes the footprint of a location. And right across the street from on the other side, when I go down Asylum, I have Aetna. So we are bombarded by the medical complex and what I call medlining. So in the same way that we call it redlining, medlining. So medical industry gentrification of the medical system. And so what is the underlying factor here is that there's a lot of poverty in Hartford. And so it's not to say that our folks aren't working. Our folks oftentimes have 2 jobs, 3 jobs, but the median income is around $29,000. And so a year. And so we have very limited access to a lot of things. There's lower life expectancy rates. There's higher infant mortality rates. And we have among the highest asthma rates in the state of Connecticut. And so, and somebody mentioned in the chat, there's Hartford Hospital. Yes, Hartford Hospital is also part here in Hartford. But in my particular neighborhood, within my walking distance, I literally can look out the window and I see St. Francis on my right. And if I go straight ahead, just walk 5 minutes, there's Aetna. And so here we are amidst a pandemic and we are being hit the hardest. We know this. Statistically speaking, we are seeing the numbers of the COVID cases. We are experiencing a lot of deaths in our neighborhoods, in our city. And so this is precisely amongst that entire picture that I just painted for you all, is precisely why we need Medicare for all. It's precisely why myself and so many other Hartford advocates are for Medicare for all. And so we know, and I recognize, and it's almost like a pleading thing, that healthcare is a human right, and then we shouldn't have to plead in this way, but oftentimes we find ourselves trying to make that argument over and over and over again, and when it's not even it should not even be debatable. And so we know that we need to change our healthcare system so that it's not profit driven and it's people driven, number one. And there's so much wealth in a place like Hartford. We see the wealth around us, and when we go to our nearing towns, there's a lot of wealth in terms of our entire country, not just Connecticut, but in our entire country. But then we allow people to go bankrupt from not having medical treatment, or being able to have to spend thousands upon thousands of dollars in medical debt. And so we also recognize people are dying from not being able to be treated. And so my own personal story, when I was a college student, I was in getting my master's degree, and I did not have access to medical insurance whatsoever. And so I was completely left out of the picture. No way to have medical insurance. I did not qualify. And so I was studying in Puerto Rico. I came back here in the summers. And so my particular story is that I suffered from ovarian cysts. And so if anyone has a relative or a loved one who suffered from that, it's very painful. It's very excruciating. So imagine being in pain and not in agony and not being able to leave your house for a week, sometimes 2 weeks. It's very debilitating, not being able to work, not being able to go anywhere because it didn't have money. And so pretty much just waiting it out and saying, well, whatever happens, happens, because that's all I had. And so that's my personal experience with not having access to the healthcare system. And then eventually when I came back, when I finished my graduate degree, then I qualified for the state insurance, and I specifically qualified to receive it because at that particular moment my income was lower. And so a lot of people in our community in Hartford already qualify for Medicare and Medicaid. So we are a community that relies on this very much. And so we have to make sure that more people within our community in general and everywhere have equal access to Medicare, rather than it being a system that's built on class. And so when I was somebody who was on state insurance, one of the things that ended up happening is I literally saw the disparity between who could I access, where could I access that treatment, and who was available to me. And so the pool started to get it started to get limited in terms of, and I personally also think that it has to do not just with class, but also with race. Now we have, that's just, I also have to clarify, there are some amazing healthcare professionals, there are some amazing doctors out there, but then there's also others who within the medical industry, the medical system, where negative stigma is attached if you have a certain type of insurance versus if you have another one, if you live in a certain zip code versus if you live in a place like Hartford. And so we shouldn't have to say, well, the folks who live, I'm going to throw out a random place, Greenwich, have better access to healthcare than, let's say, those who live in Hartford. That needs to be abolished, that we have to completely do away with that. And so we can't have inferior systems when we're talking about access to healthcare. And these are all the reasons why I'm supportive of Medicare for all. And on top of that, just as important in the conversation is talking about single payer, because it does away with the administrative costs, it does away with the controlling of prices, and it includes people who don't have employment. And another thing that I could throw personally in there is that when the Affordable Care Act rolled out, I was somebody who worked for Access Health. And so I was part of the beginning crew of the Navigator Assister program. And I trained with others, and I would train others to help individuals actually select their plans, figure out what they were eligible for. And I distinctly remember that when the Affordable Care Act first rolled out, and I would sit down with folks, and there were some pretty great subsidies. And I said, wow, federal government's really stepping up here, and some of these plans make a lot of sense. A year passed, I was no longer working for Access Health, and I myself was applying for the Access Health plans within the networks. And I found that the prices had dramatically increased from the initial rollout. And this is something that we hear on a consistent basis, which is that the premiums and the pricing is not regulated. You can have one plan for 1 year, and then all of a sudden it skyrockets. And so all of these things really exacerbate the system that we have, which is precisely why we need a new system in place so desperately for so many people. And a place like Hartford, this is like a prime fertile soil, and we're in a unique position because we are ground zero. Not only do we have the big hospitals, but we have the insurance companies here, and we have the institutions that hold up the current system. And we have individuals like myself who day in, day out, we see the inequalities that have existed within the system that we have. And so we can't scapegoat insurance into creating the jobs for us. In Hartford, we have firsthand knowledge of how the jobs within the health insurance system are not even accessible to the community that is here because there aren't any community benefit agreements. And so that's a reality. But at the same time, we also see that the health insurance jobs, and the system that has been created is a system that is based on suffering. And so the last component of it is that because we have such a big immigrant population, and particularly we have an undocumented population, they want to make sure that they also have access to healthcare. And that's an important part. And so with that, I just want to finalize and say one specific point, which is that we are here to also do advocacy work alongside all of you who've been doing this work for a very long time. And we are in a unique position. And I personally would be more than happy to do whatever we can so that the message can further get amplified. I thank you for my time.